Cancer Research UK has teamed up with the universities of Cambridge, Manchester, University College London and Stanford and Oregonchick universities in the United States to share ideas, technology and experience in this area. Along scientists aim to develop less invasive tests, like a blood test, urine and breath test for monitoring patients with high risk, to improve imaging techniques for early detection of cancer and to search almost known signs of the disease. The fundamental problem is that we can never see how the emerging cancer in the human body, says Dr. David Crosby, head of research of early diagnosis at Cancer Research UK. For example, researchers from the Manchester grow tissues of the human breasts in a laboratory with synthetic immune cells to see if they can notice the early, very subtle changes that can lead to cancer. Therefore, cancer researchers say they must use more accurate methods, and to consider the genes with which people are born, and the environment in which they live to determine a unique personal risk of various cancers in humans. Today, according to scientists, research on early diagnosis was small and fragmented. They lacked the possibility of testing large populations of people. Dr. Crosby stated that the cooperation will lead to huge changes in our health systems, shifting the emphasis from expensive disease in the later stages on the opportunity to intervene at the very beginning and provide rapid, cost-effective treatment. The figures show that 98% of patients with breast cancer live for 5 years or more, if the disease is diagnosed at the first, the earliest stage, in comparison with 26% in the fourth, most late stage. However, while there are no reliable tools for screening of oncology diseases of other organs such as pancreas, liver, lungs and prostate, this means that the positive outlook in these cases is much lower. Professor Mark Emberton from UCL said that the development of imaging techniques, like MRI, is the quiet revolution that can replace the needle used for biopsy in the diagnosis of prostate cancer. Visualization only sees aggressive cells, it bypasses the unnecessary things and addresses issues of overdiagnosis, he said, but warned that this method is costly and time-consuming, and not yet ready for full use. Now I test more accurate methods, such as pan position MRI scan and photoacoustic visualization, where the laser beam is delivered to the tumor, creating sound waves that analyze and create the image. Professor Fitzgerald said that he hoped the collaboration with colleagues from other countries to develop these ideas all the way, from research to direct patient care.